7 fruits diabetics must avoid at all costs. Let's kick off this video with some good news for those living with diabetes. Recent research has shown that consuming whole fruits, particularly having 2 servings per day, may reduce the risk of developing type 2 diabetes by as much as 36%. This is an exciting finding for anyone concerned about their blood sugar levels. However, not all fruits are beneficial for people with diabetes. In today's video, we will explore the types of fruits that Dr. Bernstein recommends avoiding completely to help you better manage your blood sugar. Stay tuned to discover the 7 fruits you should avoid immediately and why they can be considered the hidden enemies of your health. To emphasize the importance of diet management, I'd like to quote Dr. Richard K. Bernstein, a leading diabetes specialist who has lived with the condition for over 75 years. Dr. Bernstein consistently highlights that strict control of carbohydrate intake is key to maintaining stable blood sugar levels and preventing long-term complications. He has developed a low-carbohydrate dietary approach focused on minimizing high glycemic foods, helping diabetics maintain normal blood glucose levels without relying heavily on medication. According to Dr. Bernstein, no food, especially sugary fruits, is worth sacrificing your blood sugar control. He consistently advises patients to make smart food choices, prioritizing nutrient-dense options that do not cause significant blood sugar spikes. His method has been successfully adopted by thousands of individuals, helping them avoid severe complications like kidney failure, cardiovascular disease, and nerve damage. This insight clearly demonstrates the critical role of dietary management in diabetes care, especially when selecting fruits, a topic we will continue exploring in the next segment of this video. 1. Mango. Let's start with mango, a tropical fruit loved for its sweet and juicy flavor. While mangoes are rich in vitamin C and fiber, they have a high glycemic index, GI, typically ranging from 50-60 depending on ripeness. A single mango contains around 45-50 grams of carbohydrates, mostly from natural sugars like fructose and glucose. For diabetics, this can cause a quick rise in blood sugar, making it challenging to maintain stability, especially if consumed without pairing with protein or healthy fats. Dr. Bernstein strongly advises against eating mangoes if you have diabetes, noting that they can undo your efforts to control blood sugar. Instead, he recommends opting for low-carb fruits that have a milder impact on blood glucose, such as berries, which offer more fiber and antioxidants without the sugar spike. 2. Pineapple. Next up is pineapple, a sweet, juicy fruit known for its distinct taste and high water content. Pineapple is often considered a healthy choice due to its bromelain content, which aids digestion. However, it's a risky pick for diabetics because of its high glycemic index, ranging from 56-60. Just 1 cup of pineapple, about 150 grain, contains around 16 grams of sugar, which can lead to a rapid increase in blood sugar levels. Dr. Bernstein emphasizes that while pineapple has certain health benefits, its drawbacks for diabetics outweigh these benefits. He suggests steering clear of pineapple and opting for safer alternatives like blueberries, which have a lower GI and are packed with beneficial nutrients for blood sugar control. 3. Grapes. Grapes are small, yet packed with high amounts of natural sugars, particularly glucose and fructose, making them problematic for diabetics. A small serving, about 150 gram, can contain up to 23 grams of sugar, equivalent to nearly 6 teaspoons of sugar. With a glycemic index ranging from 49-59, grapes can quickly spike blood glucose levels, even when eaten in moderation. Dr. Bernstein advises diabetics to avoid grapes, noting that even a small portion can significantly impact blood sugar levels. As an alternative, he suggests choosing low-sugar fruits like blueberries, which offer a healthier profile and are less likely to cause glucose spikes. 4. Banana. Bananas are one of the most widely consumed fruits worldwide, loved for their convenience and high energy content. However, bananas are also high in carbohydrates, primarily natural sugars like sucrose, glucose, and fructose. A medium-sized banana contains about 27 grams of carbohydrates, and its glycemic index, GI, can range from 51 to 62, depending on its ripeness. The riper the banana, the higher its sugar content, making it even more problematic for diabetics. Dr. Bernstein strongly advises diabetics to avoid bananas, explaining that they can lead to sudden and significant blood sugar spikes. Instead of bananas, he suggests reaching for lower GI fruits like Granny Smith apples, which are not only lower in sugar but also provide fiber that helps slow down the absorption of carbohydrates, aiding in better blood sugar management. 5. Watermelon. Watermelon is a refreshing and hydrating summer fruit, but for diabetics, it can be a tricky choice. With a high glycemic index, GI, ranging from 70 to 80, watermelon can quickly spike blood sugar levels. A single serving, about 150 gr, contains 12 gr of sugar, and due to its low fiber content, the absorption of sugar into the bloodstream happens rapidly. Dr. Bernstein warns that despite its low calorie content and high water volume, the impact on blood sugar is significant. Instead, he advises opting for fruits with a lower GI such as strawberries, which help maintain stable blood sugar levels. 6. Peach. Peaches are sweet and packed with vitamins A and C, but they also come with a medium to high glycemic index of 42 to 55, especially when fully ripe. A medium-sized peach contains about 15 g of carbohydrates, mainly from natural sugars. For diabetics, consuming peaches can cause unexpected blood sugar spikes, especially if more than one serving is consumed. According to Dr. Bernstein, diabetics should limit their intake of peaches or switch to lower sugar alternatives. For instance, raspberries are a great substitute with a lower GI and high antioxidant content, offering a safer choice for blood sugar management. 7. Cherries. Cherries, while small, are packed with natural sugars, particularly sweet varieties. A small serving, 150 calories, can contain up to 18 g of sugar and have a GI ranging from 55 to 63. For diabetics, even a small portion can exceed the daily recommended carbohydrate intake, making blood sugar spikes more likely. Dr. Bernstein recommends avoiding cherries altogether, as even a modest amount can significantly raise blood sugar levels. Instead, he suggests opting for blackcurrants, a low-sugar berry with high fiber content that helps control blood sugar more effectively. Choosing the right fruits is essential for diabetics aiming to keep their blood sugar levels stable. Be mindful of high GI fruits with high natural sugar content. To safeguard your health, continue following our videos for more diet tips and expert advice from Dr. Bernstein.